Hi, my name is Ashley, and I'm a first-year medical student. Is it okay if we talk about weight? The weight of our words. An investigation into clinical discussions around weight loss, based on a true story. A few weeks ago, I was at a free health clinic practicing my clinical skills, mostly vital signs and routine stuff. However, one of the cardiologists who was volunteering had brought his bedside echo equipment. We gathered around him as he demonstrated how to use it and how to interpret the fuzzy images on the screen. He gave the patient a series of birth commands: lie on your left side, move this arm, and diagnosed it as mild dilation of the left ventricle. He told us we could see it, but it was really hard. Then our lesson was interrupted. The patient asked the doctor a question. But what can I do about it? The doctor replied, well, all of your problems would go away if you just lost weight. As a first year, a few months into medical school and just learning the basics, this is the moment I'm most interested in. How to motivate patients to make healthier choices without seeming like you're judging them. The cardiologist went through the patient's BMI, which at 40 indicated he was obese. The patient was aware of this classification, but the doctor just kept berating him on it. He said he was carrying the weight of 10 bodies on one frame. The patient cut in with something really shocking. He said, I started eating after I was gang raped in prison. They told me I was too skinny. With a crowd of med students gathered around him, on the floor, shirt off, the cardiologist towering over him and giving him a lesson, he had just revealed something so private and intense. It really made us rethink some of the things that were said earlier, like that line about the 10 bodies on that one frame. For this particular patient, he might be remembering a literal weight. It made me think of a book that I was reading around that time. It's called Hunger by Roxane Gay. It's an autobiography about the author's experiences with weight gain after a traumatic sexual experience. She writes, I was swallowing my secrets and making my body expand and explode. I found ways to hide in plain sight to keep feeding a hunger that could never be satisfied, the hunger to stop hurting. So there was the patient on the ground, and all of us, his medical team, around him. What should we have done differently? Eventually, the physician said, yes, but focus on losing weight and you'll feel better. We tried to find little ways to encourage the patient, but it wasn't enough. If we really wanted him to lose weight and be healthy, we would address the psychosocial causes of his hunger. When I left the clinic that night, I said, thank you, doctor, I learned a lot today. I've been thinking a lot after that night about how to talk to patients about issues that they might be self-conscious about or that might be tied to specific events in their past. What's clear to me is there's no way to treat the body without treating the mind as well, because it's all linked in one package, which is a person. So this is a reminder to think about the weight of our words, especially in the context of clinical discussions around weight loss.